This is Amir Bushra from Merck Serono, Middle East. I'm the Medical Manager for Neurology, responsible for the Gulf region. We are very happy to share with you the results of this study about the pregnancy safety outcomes in MS patients who have been exposed to subcutaneous interferon-beta. These are results from the GCC region. As an introduction, women with MS are often diagnosed and treated at childbearing age. That's why the family planning and pregnancy is a very important topic for both patients and for the HCPs. Recently, interferon-beta label has been updated to include the use during pregnancy if clinically needed and during breastfeeding. We know that data from different registries have shown that the use of interferon-beta before or during pregnancy, especially in the first trimester, didn't adversely affect pregnancy and infant outcomes. That's why the objective of this study was to carry out a descriptive analysis of data from our local safety database for pregnancy outcomes in MS patients receiving subcutaneous interferon-beta from the GCC region. So, in a collaboration with our local drug safety team, we extracted the results of the adverse events related to exposure to interferon-beta before or during pregnancy for MS patients for the period from 2015 till the end of 2019. When we extracted the data, we found 224 adverse events reported in this period, and these were identified in 114 cases. The main countries where we had these adverse events were KSA, UAE, Kuwait, Bahrain, and Oman. Looking further to the data, we found that the average age for the patients was around 31 years. Looking at the frequency of the events, we found that the normal newborn outcomes was identified with the highest frequency, while other serious adverse events like the premature baby, premature delivery, low birth weight accounted only for 2.23% of all adverse events identified in the GCC region. For the spontaneous abortion, it was only 1.79% of the reported adverse events, while others adverse events only reported below than 1%. When comparing these results with Merck Global Safety Database, we found that this data has shown no abnormal adverse event trend in the GCC region. The following pages show a table of the frequency of the serious adverse events, as mentioned before, and this table is showing the other key non-serious adverse events reported, and as we see, all of them were less than 1%. As a conclusion, the GCC data showed that the exposure to interferon-beta 1A, especially subcutaneously, before and after or during pregnancy, especially in the first trimester, doesn't adversely affect the pregnancy or infant outcomes. This data is consistent with the data collected from other registries and from Merck Global Safety Database. I would like to thank you for your attention, and we are looking forward for your questions and comments. Thank you.